Good morning, everyone. My name is Lhamo Dolkar. I'm the president of the Registered Nurses Association of Ontario and a practicing nurse practitioner. And I'm honored to serve as your moderator for today's launch of Addressing Anti-Black Racism in Nursing Best Practice Guideline. Before we begin, we would like to offer the land acknowledgement. We recognize that our work and the work of our members takes place on the traditional Indigenous territories across Ontario. We also wish to acknowledge that Queen's Park Legislative Building and RNAO's head office are both located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Bell Covenant, which is an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also acknowledge that Toronto is covered by Treaty 13 under the Toronto Purchase Agreement with the Mississaugas of the Credit. Today, this land is still the home to many First Nations, Inuit, and Métis people from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, we are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back more than 10,000 years. We encourage each one of us to learn about the land we reside on and the territories that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. I want to now acknowledge our colleagues, nursing leaders, leaders of different organizations, and of course panel members. And I acknowledge most of all the leader of the official opposition party who is here today, which speaks more to why we are all here and committed. So I'm going to name all the attendees to acknowledge them. Merritt Stiles, Sue LeBeau, our president-elect, Dr. Claudette Holloway, our past president, Dr. Doris Grinspan, CEO of RNAO, Victoria Alarcon, Communications, RNAO, Anukul Thakur, RNAO Communications, Sylvie Crawford from CNO, Maya Nikolowski from CNO, Akil Ade, thank you for being here, Bobette Bradley, Tanya Lafleur, Christine Kiaze, Chinyer Ba, Janet Montag, Magdalene Ogudu, Dr. Nadia Prendergast, Shakirat Sims, Donna Lawrence, and Laurie Zozolito. Thank you all for being here today. I will now introduce our speakers, our panel members, RNAO past president, Dr. Angela Cooper Brathwaite, who will now share the Black ancestral land acknowledgement.
Good morning. As people of African descent, we offer this land recognition in solidarity with Indigenous peoples of Turtle Island in their thoughts and deliberate intentions towards decolonization. We acknowledge the land of Turtle Island that was never meant to be owned. We recognize that most of the land was entrusted to the Indigenous peoples, was in some case shared by choice, but all too often taken by force. We recognize the historical colonization and the ongoing colonization that has led to the present-day situation where land acknowledgements are offered in place of land. As people of African descent, many of us have come here by choice, while many are here as a result of historical force. We acknowledge the complexities where we are promised land and was never given by those who it was never to be given. As people of African descent, we acknowledge that the Turtle Island that sustain us express deep gratitude to its Indigenous peoples and pledge to honor our dignity, divinity that ultimately connects us all. Now I'll turn it back to Lhamo Dolkar.
Thank you, Dr. Angela Cooper Brathwaite. Today represents an important milestone not just for RNAO, but for nursing and other healthcare professions in Canada. We are here to recognize the voices, experiences, leadership, and expertise of Black nurses who have long been calling for systemic change within nursing practice, education, research, and leadership. Allow me now to provide some background and set the stage. Anti-Black racism remains deeply embedded within structures of healthcare and nursing, affecting educational pathways, workplace experiences, career advancement, psychological safety, and the ability of Black nurses and Black nursing students to thrive in their chosen profession. This guideline is a response to decades of testimony, research, and advocacy. It provides concrete, evidence-based recommendations to confront anti-Black racism in nursing and to build safe environments where Black nurses and Black nursing students can learn, work, lead, and innovate without racial harm. Before I present the speakers, let me introduce the person who envisioned this guideline, Dr. Doris Grinspan, the CEO of RNAO. Later, we will hear how her leadership engaged the formation of the RNAO Black Nurses Task Force and how, alongside Dr. Angela Cooper Brathwaite, they envisioned the formation of an interest group and the idea for the evidence-based guideline we are launching today. Now, I'll take a moment to introduce today's speakers. We are joined by incredible leaders who helped shape this guideline. Dr. Angela Cooper Brathwaite, who provided the Black Ancestral Land Acknowledgement, is an expert panel member and former RNAO president and co-chair for the Black Nurses Task Force. Dr. Cooper Brathwaite is an adjunct professor and associate graduate faculty member for Ontario Technology University in Oshawa. She has a PhD in nursing from the University of Toronto. She's a fellow of the American Academy of Nursing and has been appointed to the Order of Ontario and the Order of Canada. She has national and international experience in nursing, teaching, and various humanitarian work. Dr. Cooper Brathwaite will speak about the origins of and the backgrounds leading up to the development of this guideline. Next, we have Dr. Bukola Salami, who is the co-chair of the expert panel. She's a full professor in the Department of Community Health Science at the Cummings School of Medicine, University of Calgary, where she holds the Tier 1 Canada Research Chair in Black and Racialized People's Health. Her research focuses on health equity, immigrant health, Black health, and health policy. Dr. Salami will share how she became involved in this initiative and led the extensive pre-development discussions, including 8 discussion groups with Black nursing students, frontline nurses, researchers, and managers. The guidelines co-chairs, Dr. Bukola Salami and Dr. Lerone Nelson, worked alongside an expert panel of Black nurses and Black nursing students from diverse practice settings, identities, and backgrounds. Dr. Lerone Nelson is a globally recognized nurse scientist, public health researcher, and academic leader at Yale University. He currently serves as the Independence Foundation Professor of Nursing at the Yale School of Nursing and holds additional leadership roles across Yale's health sciences community. He's joining us today virtually. And finally, Dr. Stephanie Buchanan, RNAO Guideline Development Methodologist and staff co-lead of the development team. With more than 30 years of experiences, Stephanie is a seasoned nurse leader with a strong background in research, professional practice, nursing education, health program development, and evidence-informed policy. She brings a critical equity lens to guideline methodology and implementation, with particular expertise in integrating social justice, anti-racism, and health equity principles into evidence-based practice. She will walk us through the rigorous methodological process that produced the guidelines, recommendations, good practice statements, and evaluation indicators. Thank you all. With that, it is my honor to give the mic back to Dr. Angela Cooper Brathwaite.
Thank you, RNAO President and esteemed Nurse Practitioner Lhamo Dolkar, and good morning, everyone. I will provide some brief context and background about the development of addressing anti-Black racism in nursing guideline. The decision to develop this guideline was not spontaneous. It was the outcome of persistent calls to acknowledge and address systemic racism experienced by Black nurses across the profession. Black nurses and Black nursing students often experience overlapping forms of systemic oppressions, including heterosexism, transphobia, cisnormativity, ableism, colorism, discrimination based on gender identity and expression. These intersecting identities compound barriers to education, career advancement, and the provision of culturally safe care while amplifying experiences of trauma and marginalization. For decades, Black nurses have reported discrimination in academic settings, hiring practices, evaluation, clinical placements, leadership opportunities, and workplace culture. These were not isolated incidents. They were pervasive patterns experienced across roles, institutions, and geographical regions. George Floyd's murder in May 2020 reignited the global Black Lives Matter movement to confront white supremacy and violence against Black people and communities. RNAO released a statement on June 3, 2020, addressing the murder of Mr. George Floyd, in which Dr. Greenspan, our CEO, called to put a spotlight on injustice and mobilize to enact real change. A month later, Dr. Greenspan called for a task force in support of Black nurses and nursing students in the healthcare and education systems. With her characteristic compassion and determination, she collaborated with Black nurses in Ontario to tackle that enormous challenge. She invited me to co-chair the task force, and a few months later, Nurse Practitioner Cosita Garway joined as second co-chair. The parameters were clear. We were to include Black registered nurses, nurse practitioners, registered practical nurses, and nursing students from across the entire province. The call for the interest in the task force members brought an outpouring of interest, 256 eager applicants. We then had to proceed and to select 15 self-identified Black nurses to become members of the task force. The task force released a trailblazing report in 2022 outlining transformative actions to advance change in the nursing profession. These truths were highlighted in the report. The release of RNAO Black Nurses Task Force report and its 19 recommendations intensified this push for action, providing comprehensive evidence of racism in nursing and making it clear that systemic transformation was needed immediately. The message from that report was clear. Anti-Black racism nursing must be explicitly named, understood, confronted, and dismantled. The work of the task force has continued through other channels. The RNAO Black Nursing Leading Change interest group, evolving from the task force, advocates for anti-Black racism, offers mentorship, and provides continuing education. It is a safe place for Black nurses and nursing students and their families to network and interact with each other. The Addressing Anti-Black Racism in Nursing Guideline is another outgrowth from the task force. The guideline responds to a long-standing and urgent need for racial justice in Ontario and Canada health systems. RNAO's best practice guidelines serve as a tool to drive evidence-based change and to promote healthy work environments. In the same way the guidelines address falls prevention, wound care, or person and family-centered care, this guideline addresses a critical determinant of health and professional safety anti-Black racism. The goal is not only to acknowledge harm, but to establish accountable, systematic, and measurable expectations for nursing organizations, leaders, educators, regulators, and policymakers through downstream impact and by increasing representation across all health settings. The guideline aims to foster trust among Black patients and promote culturally safe care and health equity for Black patients. This guideline is an important step in answering the call. We will hear more about it from the speakers that follow. Thank you, and I will now pass the mic over to Dr. Bukola Salami.
Thank you so much, Dr. Angela. So my involvement in this guideline began with my academic and community engaged work, which has been focused on immigrant health, Black youth mentorship, anti-racism, and health equity. When RNAO invited me to co-chair this expert panel alongside my colleague, Dr. Laron Nelson, I immediately understood the deep significance of this work and also the responsibility it carried. Before we began writing recommendations, we needed to hear directly from Black nurses and also from Black nursing students. To lay the foundation, Dr. Nelson and I did a series of powerful consultation, which included 8 discussion groups involving 23 participants. And these participants included Black nursing students, frontline nurses, nurse managers, and also nurse researchers. These sessions reviewed persistent experience of racism and microaggression, a lack of psychological safety in academic and workplace setting, barriers to mentorship, promotion, career advancement, and also leadership, systemic exclusion and critical decision-making spaces, and also feelings of isolation and fear of reprisal when reporting racism. These recommendations were essential. They helped ensure that the guidelines would not only be informed by academic literature, but also reflect the deep-rooted trauma and lived experiences of Black nurses. With this insight shaping our direction, the next step was to convene an expert panel to support the development of this important guideline. The expert panel comprised of 18 Black nurses, each bringing diverse expertise from acute care, public health, long-term care, research, policy, and also nursing education, with the greatest appreciation for their many years of contribution and their dedication that helped to shape the development of this guideline. It is critically important to take time to acknowledge each of these expert panel members. As co-chair of the expert panel, I wish to thank my co-chair, Dr. Laron Nelson, as well as Akil Ade, Dr. Patricia K. Bradley, Bobette Bradley, Dr. Angela Cooper Brathwaite, Damilola Iduye, Dr. Keisha Jeffries, Christine Sipiwe Kizyaza, Tanya Lafleur, Chinyere Umba, Janet Montague, Magdalene Ogudu, Mary Olukotun, Ovi Onagbe Boma, Dr. Nadia Prendergast, Shakira Sims, and Dania Vassels. I will close my remarks by offering a core question. Why does this matter? The guideline is both an act of accountability and also an act of hope. It offers us a framework for dismantling systemic racism within nursing and also advancing environments where all Black nurses, current and future, can thrive. Thank you so much, and I now turn it to Dr. Stephanie Buchanan.
Thank you, Bukola. As part of the RNAO guideline development staff team, together with my colleague Lindsay Howitt, I had the privilege of co-leading the methodological process for this guideline. We could not have accomplished this great work on our own. Our team members, Dr. Doris Grinspan, Dr. Michelle Ray, Amy Burt, Nafsin Nizam, Julia Zukal, Glynis Gittins, and James Oliveri all contributed in many significant ways to this guideline. Let's talk about the guideline's purpose. The expert panel determined the purpose of this Healthy Work Environment Guideline, which is to address anti-Black racism in nursing and improve inclusivity and retention of Black nurses and Black nursing students in health and social service organizations and academic institutions. This guideline highlights the harmful history of marginalization and discrimination experienced by Black nurses and Black nursing students, illuminating the impact of systemic racism in the nursing profession. Advocacy and collaboration focused on eradicating anti-Black racism and racism more broadly is essential to achieving equity and transformative change in nursing. The scope of the guideline includes all domains of nursing practice, including clinical care, administration, education, policy, and research. All designations and roles of nursing and nursing students. Also includes Black nurses, Black nursing students practicing in all settings and sectors, including but not limited to primary care, public health, home and community care, mental health, acute care, long-term care, and education settings. Our work followed RNAO's internationally recognized and rigorously peer-reviewed model for guideline development, which includes elements of the grading of recommendations, assessment, development, and evaluation or grade approach. This includes systematic reviews of the literature with close to 20,000 papers screened, a scoping review, multiple rounds of expert panel deliberations, external review by more than 75 nurses, nursing students, and other health providers from across Ontario. Broadly, the guideline contains 3 recommendations and 5 good practice statements that fall into 2 broad categories: education and organizational policy. It covers what nurses and healthcare professions need to learn and the high-level actions required to foster accountability and organizational change. The high-level recommendations and good practice statements focus on the following: ongoing education for students, faculty, staff to address anti-Black racism in nursing, zero-tolerance policies regarding anti-Black racism in nursing, retention, recruitment, and career advancement of Black nursing students and Black nurses to increase representation, formal mentorship programs to address anti-Black racism in nursing, and formulating anti-racism, diversity, equity, inclusion, and belonging committees that include Black nurse leaders, Black representation from all levels of health and social service organizations and academic institutions. The guideline also illuminates the detrimental impact of systemic racism and intersecting forms of discrimination in the nursing profession. It provides guidance to help nurses, health professionals, and faculty to uncover hidden racism in today's healthcare environment and the harmful history of marginalization and discrimination experienced by Black nurses and Black nursing students. And finally, it provides guidance on collecting race-based data and identifying indicators to evaluate the impact of the recommendations. Through advocacy and collaboration, the guideline is focused on tackling and eradicating anti-Black racism and racism more broadly to achieve equity and transformative change in nursing. So in conclusion, the Addressing Anti-Black Racism in Nursing guideline supports all leaders, educators, nurses, healthcare professionals, and institutions in moving beyond symbolic acknowledgements towards meaningful, structural, and sustained action. It will help to tackle discrimination and reinforce the Canadian Human Rights Act. It will help combat anti-Black racism in nursing and improve inclusivity and retention of Black nurses and Black nursing students. Now, I will hand the mic over to, and lastly, it will inform policies, procedures, protocols, educational efforts to deepen awareness of systemic racism and anti-Black racism. And direct care clinicians will benefit from reviewing the recommendations and report evidence to guide their practice and that of others to improve patient outcomes. And now I will hand it over to Lhamo Dolkar.
Thank you to all our speakers, Dr. Angela Cooper-Brathwaite, Dr. Bukola Salami, and Dr. Stephanie Buchanan for your leadership and insights. This guideline represents collective wisdom, expertise, and courage. More importantly, it represents a commitment to a future where Black nurses are fully supported, valued, and free from racism and other intersecting forms of discrimination in every part of the profession. I would now like to open the floor for questions. Please feel free to ask about the role of institutions and leaders in driving systemic changes, the guideline development process, the recommendations themselves. Our speakers will be happy to respond.
I have a question for Dr. Bukola. I understand you live in Alberta. Would you feel comfortable sharing with us what this guideline means for you, given Alberta's recent stance on DEI policies?
I think it's especially important to situate the guideline in the global context and also in the national context. So we know some of the things happening now in the US with the rise in anti-racism and anti-EDI sentiment. Across Canada, we also have a rise in anti-EDI sentiment. So for example, we recently had a debate in Parliament questioning whether EDI should be integrated in research design or research practice. In Alberta, we currently have a policy that has been recently become law this year that is focused on deterring mandatory education on cultural safety, cultural competence, and equity, diversity, and inclusion. And this serves as a threat to achieving some of the recommendations, implementing evidence-based practice, and also achieving some of the recommendations in the Truth and Reconciliation Commission. So we do have to continue to address some of the systemic anti-Black and the rising anti-woke, anti-EDI sentiment that is happening across Canada. It has implications not just for nurses, okay? It has implications for patient care. It has implications for population health outcomes. When Black nurses experience racism, it has implications in terms of work environment, and we know that positive work environment contributes to positive patient outcomes. And that is not just for Black patients, it is for all patients.
Thank you. I have a kind of follow-up, Dr. Angela. I was hoping you could shed light with this work and the work of the larger panel. Does this bring hope to you, especially considering the environment that we are in as of now?
Yes, it brings hope, and I think I will use a word like fight. It seems as though we are always fighting to achieve what other people take for granted. We are fighting to achieve. And unless some people experience racism and the impact it has mentally, physically, psychologically, some people will never understand it. And some who are allies learn to empathize. Just recently, I was doing a presentation on part of the study we did for anti-Black racism. And one of my white colleagues said to me afterwards, she said, I didn't know you people experience all these things. How do you manage to do your work? She was an ally who has empathized by hearing the struggles that Black people go through on minority groups, not just Black, and Indigenous people, she began to empathize. Some other people will say it doesn't exist, so we don't have to do anything about it. Okay? And unless people acknowledge that racism exists, nothing will be done in all institutions. But we who are experiencing it cause psychological. A lot of people have mental health issues. Some of the students who were present at that presentation I was giving said they've quit nursing because the pressures are too great. Do we always have to fight for what everybody has equality? Don't we need to be treated equally with respect and dignity?
Thank you. I want to ask Dr. Buchanan, you've worked and you would have seen your experiences working as a nurse. How does that translate? It's taken its time, but how does it feel to now having worked on this guideline?
Thank you for the question. Working on this guideline has been, it's been a convoluted process, but it's been an eye-opening process and also on many levels a labor of love and a journey of healing. It's been a multi-year process, and I consider it a privilege to have been able to work with a fantastic team, to have had the opportunity to be given a voice, to be able to work on something of such great significance in my life, based on my lived experience and those of others on the panel, and even those that reviewed the guideline. It's meant quite a lot in many ways, still processing, but I think if I had to give one complete thought as to the impact of working on this guideline, I believe that, as you had mentioned before, it gives us hope. It not only gives us hope, it gives us a voice. It gives us a voice because after reading many, many, many thousands of studies and reflecting on the voices, because as you read them, you hear others' voices, you hear others' lived experiences, you feel it viscerally. It was quite monumental to be able to feel as though we had the privilege to be able to bring all of the evidence together that validated how many of us have felt for years and years and years without actually having the voice to be able to speak about it. Said all that to say it's been a privilege, and it's been a great journey.
Thank you.
I would like to add, this is why RNAO is doing what it is doing, because it aligns with the values of social justice. It aligns with the value of advocating for equity-deserving communities. You know, RNAO has done great work, and I think it's very progressive in the stance that we've taken. RNAO as an organization has talked about EDI long ago, but even before people even started thinking about racism. You know, it's easy to say, oh, racism doesn't exist in workplace organizations, but that means that you're creating that invisibility of the issue. And that's why representation is important. That's why organizations like RNAO continues to advocate. And I think we should give due accolades to our professional college, the CNO, for listening to us, to RNAO, to the nursing profession. You know, we have 57,250 plus members, listening to them to create the census, the race-based data, and we want to say thank you for doing that, because you know, it speaks to how we can work collaboratively to bring this information back. the results that have been circulated now by the CNO speaks to why, you know, certain communities are not represented in leadership opportunities. They are just more frontline and not, you know, climbing the ladders of the success that they deserve. And I think we need to think about it more systemically. We need to understand where health system transformation needs to happen, taking the communities together and collaborating to create an equitable society for all of us. Everyone needs to be included. Everyone deserves to be included. And I think that's where we work as a team, as RNAO. And I thank you all for, you know, this sometimes as lived in experience, it's really hard to relive. Sometimes we don't even know because it's repressed. We have to reflect on it. And when it comes out, as you say, it's a journey of healing, but it's a journey of also creating that hope that you asked about for our younger generation to know that this is a safe space for all of us to be able to speak our minds and to be respected, and we all agree to disagree, but that's where we need to work together.
I would also like to add that this anti-Black racism, addressing anti-racism, is also for institutions, leaders across healthcare, whether it's academia or whether it's hospital settings, wherever. Because you have people, the city of Toronto is the most culturally diverse city in all of the world. People should look at Stats Canada, okay? 2021 census. When you think of the population of Black, Asian, or say ethnic groups, we have them, not only in the city of Toronto, but greater Toronto area. And if we fail to acknowledge that racism exists and take some initiative to address our structures and our policies in place and to implement policies that address racism, we are failing to acknowledge the people groups in this country that makes up Canada. And we could go way back further, not just to the indigenous people, but the Chinese people that helped build that bridge across Canada, the railway, straight to BC. I remember the first time I saw it, and I said, and have this Chinese guy. He said, I will do it. And he was carrying something that was going to not only blow up that piece of property, but also injure himself or kill himself. We have to acknowledge not only the past, but to move from the past into the future and embrace all people, because we all have something to contribute to this country.
Thank you. I'll just add to that. I just really, really want to thank RNAO for taking it on, especially continuing to take it on even after anti-EDI sentiment started. And I think for a lot of people, they would say, as you said, racism doesn't exist. Mm-hmm. But the Black Nurses Task Force said, okay, maybe you don't think it exists. Let's uncover this and let's do the research. Mm-hmm. And we have several research studies led by Dr. Angela Cooper Brathwaite, led by others, that have shown Black nurses experience racism. We also know in the days of COVID-19 what happened, because Black nurses were segregated, or Black people were in the lower ranks of the healthcare workforce and in the workforce, that we had more higher death rate and mortality rate from COVID-19 pandemic. And when you think about it, it's not just an issue of Black people. If we do not solve the issue about health inequities experienced by Black people, based on the inequities they experience in the workforce, we will never be able to solve the population health outcomes. So then after COVID-19 and after Dr. Cooper Brathwaite released the report, then people are like, okay, so what do I do about this, right? And I think the beautiful thing of what we are doing today is now you know what to do, right? You have 6 recommendations that you can do. You know, you can create mentorship program. You can promote black nurses. You can have zero tolerance policy. You can have a safe reporting system. You can have a committee that includes and continue to advance anti-black racism. You can provide education and so many others. So if you come back to me next and say, what can I do? The recommendations are there. And also, do you know that this is not just about recommendations of do this, do this, do this. It's also about evaluate and be accountable, okay? Because oftentimes we have guidelines, and people just implement and they think, oh, you know, things are going to be perfect on its own. We must evaluate it, and we must do course correction if things are not working in the most superb way. This is a way for us to drive, not just from us saying it doesn't exist, to yes, it exists, and then to yes, it exists, we are going to do something about it, and yes, it exists, we are going to be accountable for our action as an institution. And we are going to be committed to improving population health outcomes in Ontario, in Canada, and globally.
I just have one more question. You mentioned there are recommendations. What is the plan to get these implemented and hold people accountable that these recommendations will be followed?
I will pass it on to Dr. Stephanie.
Yeah, absolutely. That's a wonderful question. How do we bring these recommendations to life? And the RNAO follows and has embedded in our structure as part of the pillar implementation science. And we have coaches that work with best practice spotlight organizations who, if they choose to take on this guideline, can embed these recommendations within their organizations, and our coaches will coach them on how to incorporate the recommendations and good practice statements within their organizations. And the other pillar that's part of the RNAO is the evaluation and monitoring component. And so, as Bukola had spoken to, it's critically important not just to have the evidence, not just to walk it out, but also to evaluate and to collect data on how the recommendations are being implemented so that we can continue that cycle and process of embedding and making sure these recommendations come alive and are embedded in individual organizations.
Thank you.
Okay, thank you, everyone. Thank you for the thoughtful questions and for this deep engagement and discussion in today's launch. The conversations that we've had here reaffirm why this guideline matters and why our work cannot stop at publication. It must live in our classrooms, in our workplaces, in our policies, and in our everyday practice. As part of our continued commitment to intersectional, equity-driven change in nursing, I'm pleased to share that on August 16th, during Intersectionality Month, RNAO will release the new intersectionality module. This resource will further support nurses, educators, and organizations in understanding how overlapping forms of discrimination shapes nurse experiences within nursing, and how we can actively dismantle the structures that cause harm. On behalf of RNAO, thank you for your partnership, your advocacy, and your steadfast dedication to building a profession where Black nurses and all nurses can thrive and work together. Together, we will move this work forward with a purpose and with accountability and a commitment to work towards creating a safe space for everyone where everyone feels included. Thank you.